Understanding uric acid is like getting to know our body's natural waste. Uric acid forms when your body breaks down chemicals called purines, found in many foods and our own cells. Your kidneys filter out excess uric acid, which is then expelled when you urinate. This process helps maintain a healthy balance of uric acid levels. At normal levels, uric acid might even act as an antioxidant, protecting cells from damage. However, too much uric acid can cause problems. The trouble begins when uric acid levels become too high, a condition known as hyperuricemia. This can happen if your body produces too much uric acid or your kidneys can't eliminate it efficiently. Sometimes it's a combination of both. When levels creep up, the stage is set for potential health issues. Understanding this basic function is the first step. Let's explore what happens when uric acid levels get too high. Gout is a painful form of inflammatory arthritis caused by high levels of uric acid. When uric acid levels stay high, it can form tiny needle-like crystals in your joints. This crystal formation leads to intense pain, often striking without warning. The affected joint becomes swollen, red, and warm to the touch. Gout commonly targets the big toe but can affect other joints like ankles, knees, and wrists. These attacks or flares can be debilitating, making everyday activities difficult. Repeated flares can lead to chronic issues, including hard lumps called tophi. Tophi can cause permanent joint damage if left unaddressed. Recognizing these symptoms early is key to getting help. What you eat and drink plays a significant role in managing uric acid levels. High purine foods like red meats and certain seafood can raise your risk. Alcohol, especially beer and sugary drinks, can also increase uric acid levels. Obesity and certain medical conditions like high blood pressure and diabetes are linked to higher gout risk. Stress can sometimes trigger a gout attack. Managing stress, diet, and lifestyle choices helps control uric acid levels. Recognizing these triggers helps you take control. Gout doesn't affect everyone equally. Certain factors increase your risk. Men are more likely to develop gout than women, often between 30 and 50. Women's risk increases after menopause due to lower estrogen levels. Age is another important factor. Older adults have a higher risk. Family history and genetics can also predispose you to gout. Knowing your family history is valuable for prevention. Diagnosing gout accurately is key to getting the right treatment. Your doctor will ask about your medical history and symptoms. A physical examination of the affected joint is important. Blood tests can measure uric acid levels, but they can be normal during an acute attack. The most definitive test involves taking a sample of fluid from the inflamed joint. This joint fluid is examined under a microscope for urate crystals. Imaging tests like X-rays or ultrasound might also be used. Understanding who is at risk helps in early diagnosis and treatment. Early diagnosis can prevent long-term complications. If you have risk factors, discuss them with your doctor. Proactive management can make a significant difference. Let's move on to managing and preventing gout effectively. Managing gout involves treating acute attacks and implementing long-term strategies. Medications like NSAIDs, colchicine, and corticosteroids provide rapid relief during attacks. Long-term management aims to lower uric acid levels. Medications like allopurinol and febuxostat reduce uric acid production. Probenecid helps kidneys remove uric acid more effectively. Lifestyle changes are crucial for managing gout. Adopting a gout-friendly diet, staying hydrated, and maintaining a healthy weight are key. Limiting alcohol and sugary drinks is essential. Consistent treatment and lifestyle changes improve quality of life. Effective management prevents long-term complications like tophi and chronic arthritis. Work with your doctor to develop a treatment plan. Living well with gout is achievable with the right approach.